Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing one new case of COVID-19. The total number of cases now is at 272. The total number of COVID-19 related deaths in Manitoba remains at 6. As of this morning, 7 individuals are hospitalized. Of that, 2 are in intensive care. 205 individuals are listed as recovered. There are 61 active cases. Yesterday, an additional 377 laboratory tests were performed. This brings the revised total to date of 23,543. I'd like to remind all Manitobans that this is National Immunization Awareness Week. This is a great time to remind parents that regular medical appointments, including those for immunization, should be continued. Immunization is certainly an important way to keep ourselves and people around us safe, and certainly our kids' routine schedules should be maintained even during this time. Medical facilities are safe, and the system has strategies in place to continue with regular medical care. So please contact your healthcare provider and work out a way to keep your regular health needs up to date. Some of this can certainly be done virtually, while others may be handled by a more regular visit, such as routine immunization. For COVID-19, our testing capacity has increased, and many more people can be tested than are seeking a test at this time. So we have expanded our testing criteria, and so if you have respiratory symptoms, cough, runny nose, sore throat, fever, even if they appear to be mild, please call Health Links for further directions on how to get tested. We remind Manitobans that there should be no non-essential personal travel. And every Manitoban, regardless of where they live, needs to be aware of this virus, needs to practice physical distancing at all times, should stay home as much as possible and leave for essentials. And when you do leave, maintaining that physical distancing at all times, washing your hands quite frequently. Staying home as much as you can is our best way to protect ourselves, the people around us, and all Manitobans, including our healthcare workers on the front lines. Please consider connecting with others virtually. I want to thank all Manitobans for their efforts for following public health advice. Our numbers have been stable and reflective of Manitobans' efforts at maintaining and flattening this curve. It's been challenging times around the world and certainly in Manitoba, but Manitobans have really stepped up. So at this point, we have not seen significant community-based transmission or outbreaks in personal care homes. We've been able to increase our testing criteria. Our healthcare system continues to expand in preparation for further cases. And right now, our messaging is still to stay home as much as possible. But we are looking at ways to start gradually lifting these restrictions, start reopening parts of our economy. We're currently looking at certain non-essential businesses that we can safely reopen while others may remain closed. We're going to do this very cautiously, very slowly. And we'll certainly be following our numbers during any time. So we are looking to be able to, in a very regimented way, start to reopen things while following our numbers very closely. Please access credible information, COVID-19. This is our website, manitoba.ca/COVID-19 for up-to-date information. And thanks again to all Manitobans for your efforts in this regard, and I'll pass it over to Lanette.
Thank you. Good afternoon. I'm Lanette Siragusa from Shared Health, and I wanted to start today by thanking the Winnipeg Fire Paramedic Services who showed their support for our staff at HSC recently when they did a siren salute down William Avenue. And we've seen some touching gestures of support over the past 6 and 7 weeks. And there's something really special, though, when it comes from a frontline partner. Better than anyone, first line responders understand the fortitude it takes to face a challenge as intimidating as COVID-19 is and take it head on. And we are grateful to have them standing alongside healthcare workers on the front line and very much appreciate their support. So thank you very much. I wanted to start talking about the licensed personal care homes. We have been addressing it in the recent weeks, and we've seen across Canada that a significant portion of COVID-19 deaths are related to residents of long-term care facilities. Specifically in Ontario, the care home residents account for more than 70% of the province's deaths, and in Quebec that number is closer to 80%. And while Manitoba is at an earlier stage of our fight against the virus, we have taken significant steps to protect this population as we've watched other jurisdictions struggle with the severe impact that this virus can have on personal care home residents. To date, we have implemented visitor restrictions, daily staff screening before entering the facility, enhanced cleaning and disinfecting protocols, as well as proper use of PPE. But we also know that we need to do more given what we know about the risk to this population. So as we look towards lifting some of the public health orders and reopening the province, we really need to take every step possible to insulate the personal care homes from this virus. So beginning on May 1st, staff in nursing and support services who typically work at multiple personal care homes will be limited to working at a single site. This new measure will further align our province with the recommendations that have come out through the Public Health Agency of Canada. They have infection prevention and control guidelines for within long-term care facilities. So we have been working collaboratively with service delivery organizations, personal care home operators, unions, and staff to ensure that this change is implemented without interrupting services while minimizing the impact on staff. The priority will be on ensuring that those staff who have the most direct, prolonged, and close contact with residents are assigned to work at a single site for at least the next 6 months. And this is a significant shift operationally, but we have been working with all 127 licensed personal care homes in the province to ensure we are ready. Our focus is now on having conversations with the staff, confirming work locations for private PCH and agency staff who work within the province, and answering any questions they may have. We're also sending communication out to the families of those residents in the personal care homes just to make sure that they're aware of what we're doing, the steps we're taking. We have looked closely at the tragic experiences in other jurisdictions, and we are applying our observations and their lessons to the implementation here in Manitoba. And I have to say again, we are at a different phase here in Manitoba, really to the credit of all Manitobans who have really embraced the public health orders and stayed home when they're sick and kept that physical distancing. We have not had any major outbreaks in personal care homes, but that doesn't mean we don't still need to do our part to make sure it's safe going forward. We're committed to this. We're committed to keeping the disruption to staff at a minimum and really focusing on the balance as well as to make sure that services are not interrupted through this change. And Manitobans, I know, expect nothing less from us, so we are going to do our best to make that happen. And the other topic I just wanted to discuss was physician tariffs. So we have looked at how we can offer healthcare services while reducing the risk of exposure and spread to COVID-19, and a significant amount of time has been spent on looking at virtual options to deliver healthcare. And we've previously spoken about the introduction of tariffs for virtual care by primary care providers. And we can provide more updated stats next week, but in the first 11 days alone, physicians billed more than 15,000 virtual interactions with patients. And over the weekend, the Manitoba government and the physicians agreed to expand the number of virtual services that are available to patients. This agreement will now include primary care visits for personal care home residents who need routine care for chronic illness. And this new deal will allow physicians to continue to shift their clinical interactions with patients from in-person to online or over the phone. And this is a really great initiative that will help patients and physicians and the staff as we continue to deal with this pandemic. So as a reminder, the move to virtual services is not intended to replace in-person care. Manitobans who need urgent or emergent attention are encouraged to seek it. And with that, we can open the line to questions.
Thank you. A reminder to our reporters online, you will have one preliminary question and one follow-up. Up first, from the Canadian Press, Steve.
Oh, hi, Steve Lambert from the Canadian Press. Just a question about the new measure at personal care homes. Does the restriction on, one worker only working at one site, does that apply to all personal care homes, public, private, for-profit, etc.?
Yes, it does.
Okay, and Dr. Roussin, the number of active cases, we're looking at very short time frames here for my question, but over the weekend, the number of active cases went up a little bit. It's a bit of a blip, and now it's back down again. Does that mean anything, after a steady downward trend? Does this little blip over the weekend tell you anything, and does it impact at all the province's plan to reopen things?
Not over the weekend there. We look to average our numbers over multiple days. So if we look at the last 14 days, we've had 29 cases, so just a little over 2 a day with that. The active cases, the recovered cases tend not to get reported over the weekend, and so you'll notice that on the curve that shows the recovered, it's usually flat over the weekend. So we'll start seeing more recovered as the week goes on. So a short time frame like that, we're certainly going to pay attention to it, but we prefer to average it out over a number of days.
From CTV Winnipeg, Michelle.
Hi, it's Michelle Gerwing from CTV. I'm wondering, Lanette, about the personal care home staff. How is this going to work for staff who have multiple positions at different care homes? Will they get more hours to make up for what they usually work, or how will that going to work?
Yeah, that's a great question, Michelle. So we will work with the staff to the best of our ability, identify where their primary location will be. That doesn't necessarily mean that's a for sure, but that we want to provide that option for staff. We are aware that there are multiple employees who work at 2 or 3 or even more sites. So what we would want to do is not impact them in a negative way. So if they are looking at their total amount of work and making sure that those hours are available to them at one site is our goal. So we'll be looking at a number of different factors. We have a tool available to us that we've been running some of the numbers and doing the assessment, looking at where they work the most, what's close to their home. I know as a nurse and an administrator, the disruption of work location and changing shifts is significant. So we want to be as considerate as we can, but also appreciating that there is a time pressure to get this done.
Also, is there going to be enough staff to meet all of the requirements for each, because every resident has different number of hours they need care for. So how, will you bring in people from outside agencies to fill the gap, or is there a gap there at all?
Yeah, we're going to start with full-time, part-time staff, and then for sure, if there's casual agency workers, we'll also include them in that to make sure that services are not disrupted. And you're right, we are looking at part of the formula is the hours per resident day. So different populations require different levels of care, whether that be more nursing or more healthcare assistance. So all that is being factored into how we're going to implement this.
From the Winnipeg Free Press, Carol.
Hi, it's Carol Sanders at the Free Press. My first question is for Ms. Siragusa. If casual agency workers are coming in to fill in the gaps, will these casual agency workers be limited to working at just one site?
Yes.
To them individually?
Yeah, that's our goal.
And will this plan take place by Friday? It's just from what I've heard from workers, they have no idea what's going on, but there is something happening and it will happen by Friday?
Yeah, that's what we're aiming for. So communication, our goal was to communicate with the staff today and start working through what the options and the process will look like. The regional health authorities, the leadership, and the PCH administrators, I'm sorry, no, just the regional health authorities, our leaders there have received a toolkit to talk about like how we need to make this happen quickly. So a lot of work has gone on over the weekend, and I just want to acknowledge that. HR, our clinical leaders, and our analysts have been working all weekend really hard. And so our goal, it is very tight timelines. I don't disagree with that, but it's important, and we're going to make it happen to the best of our ability.
From Global, Brittany.
Good afternoon. Dr. Roussin, Canada's Deputy Chief Public Health Officer, says he's been in touch with federal and provincial health officials who've identified 4 criteria for relaxing restrictions when it comes to the pandemic. I'm wondering if Manitoba meets all 4 of those and when we can start seeing a detailed reopen plan.
Yeah, so we're looking at likely this week, we're going to be starting to discuss our reopen plan. And of those criteria, we will be meeting them, especially with the measures in the PCH by the end of the week. There's still, we still have to watch our PPE supplies, which is a criteria as well for the health system. But certainly within range of all of those things by the end of the week is where we're looking to be.
I know we've started seeing some reopening plans. Saskatchewan saying some things as early as May 4th. Quebec today announcing the reopening of some elementary schools is imminent. When could we see that initial start to reopen some of these non-essential businesses at the very earliest?
Yeah, well, that's what we're going to announce the detailed plan this week, and then looking in the upcoming weeks to be able to do just that. So we're looking at certain non-essential businesses that will be able to open. Again, it's not a return to normal. There'll be a number of restrictions on that, but we'll wait until we announce those details later this week.
From the Brandon Sun, Drew.
Thank you. This is Drew May from the Brandon Sun. We're hearing that the operating room at the hospital in Flin Flon has closed. Just wondering if that's due to the COVID-19 situation or something else entirely.
Yeah, I would say no, it's not. As we look at decreasing services and now increasing the surgical capacity, Northern Regional Health Authority has been part of those conversations, and the decision to not have or to not increase necessarily in Flin Flon is likely more due to human resources than to COVID-19.
Okay, thank you. And my follow-up question is for Dr. Roussin. But today we've seen the Ontario reopening plan, at least some kind of high-level details come out. How similar do you anticipate that the Manitoba plan will be to that one?
Well, so I mean, a lot of the criteria that the jurisdictions are using are much the same. They're what we work on at the Special Advisory Committee. So those criteria will certainly be similar. The details of our plan, we're going to really announce that hopefully later this week, and so we'll leave the details for then. But for the most part, each jurisdiction is going to do so what works best in their jurisdiction, what's best to their numbers, and so we're going to do ours very cautiously here.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, my question today is about food trucks. So obviously the weather is getting nicer and now sort of when things would start to pick up for food trucks, but obviously with social distancing requirements, they're not being booked for events due to sort of gathering sizes and that sort of thing. Will food trucks be allowed to operate at some point? And if so, what will that look like in terms of new protocols they might have to follow?
Right. So in these areas, so the one being outdoors is one factor which reduces some of the risk. It's a pickup process which restaurants are currently allowed to function as, but it's going to be all depend on the ability to maintain space. So all the patrons are going to need to be able to be that 2 meters apart. There's not going to be able to have seating that's close together, and meticulous disinfection will be required. So those are the type of things that are really going to be in place with any non-essential business that's going to be opening up. Is meticulous disinfection, as well as a screening of patrons and workers, and the ability to maintain that physical distancing.
And as a follow-up, we're hearing Quebec is announcing a plan to allow primary school children back, kind of similar to what Denmark is doing. Those children expected to go back in a couple of weeks. What do you think of that idea, and is there herd immunity kind of achieved at all in this way? I know we've kind of seemed to have written this school year off by this point, but what are the risks of sending children back to school in Manitoba before the end of the school year would come in June?
So we've been looking at this as part of our reopen plan. Certainly details are yet to come. We're still making some decisions on this. We know that unlike the influenza, or unlike many other respiratory illnesses, young children seem not to be big spreaders of COVID-19. And so when we look at that epidemiology, the more we learn about this virus, younger children are not playing as big a role as they do in other kind of respiratory illnesses. So that's why there's some push to returning some kids to school. So certainly the risk is just the pure volume. There's lots of kids to return there, and we don't want more spread, even though it seems to be less likely in children.
From the Winnipeg Sun, Scott.
Scott Billick here, Winnipeg Sun. First question for Lanette. Just wondering what is but not to worry, but I guess, when you just go down to one staff per having staff at one facility, I imagine a lot of the residents at different personal care homes, school relationships and stuff like that. Is that being taken into account, or how are, I guess, the residents being let or known that, maybe their routines are changed?
Yeah, as much as possible, if someone works primarily in one personal care home, we want them to stay. Like we won't be disrupting just for the sake of disruption. So we would keep them where their home base would be at all if at all possible. And you know what, the word that we're getting from other jurisdictions who have gone down this path, namely British Columbia, but also Ontario's looking at it as well, is that this is really a great opportunity to improve the continuity of care for these seniors. So we're hoping that, you know, as disruptive as this might feel for the staff, we're going to make it as easy as possible. And maybe in the long term, it's going to actually be better for the healthcare system and especially our seniors population.
Yeah, I guess that's my, kind of a follow-up. Is this something that will stay in, obviously there's 6 months or this, but is this something that the province would look at doing after COVID goes away and all that stuff to have maybe just to ward off, I suppose, different types of infections that come up and that sort of thing?
Mm-hmm. Well, for sure, the 6 months is where we're starting right now. That may be extended. We'll have to see what this COVID-19 pandemic brings over the coming months. And I think it would behoove us to make sure that we're evaluating and looking for opportunities. There's lots of things that are happening during this pandemic that, you know, there's a lot of hard things happening. There's also a lot of great things happening. And we want to make sure that we leverage those good things and keep it going. So we'll continue to monitor this particular situation and look for where the benefits are that we can carry on longer term.
From CBC Radio Canada, Mohammed.
Hello, it's Mohammed from CBC Radio Canada. I have a question about the backlog for non-urgent surgeries. Do we know how big is this backlog postponed from March?
No, we actually don't know that. We can identify how many operating room days have been canceled, and we can compare that to last year. But what has happened, Mohammed, is that if the surgeons aren't booking surgery, then the booking request doesn't get into the system. So it's really the surgeons' offices will know who's urgent, who's waiting, and it's up to them to assess and book as there is capacity right now. So we don't really know because each individual, we have over 100 surgeons and they are seeing patients in their clinic. They are prioritizing what needs to be done when. And it's only if they actually book the patient for surgery that we're able to assess and look at what those impacts are.
Great, thank you very much. And as a follow-up, we noticed that in some provinces there is less people coming to hospitals emergencies because of the virus. Do we know if this is the case here in Manitoba?
Yes, we do know that that is the case here in Manitoba. Just like every other province, I understand in Canada, is the number of emergency visits has gone down quite significantly since early March when we got our first COVID case.
From CBC Manitoba, Bart.
Bart McKee, CBC. Ms. Siragusa, home care workers are still only getting access to one mask a day. What's being done to ensure workers get more of them?
Well, I would have to figure out what the specific situation is. So I know that logistics is delivering the PPE to the regions as requested. I think they're doing a weekly basis. They're sending it out weekly. So probably the sites, the regions are looking at making sure that those high priority areas have the masks that they need, and will be distributing to all others as soon as possible. So if they haven't received it yet, they should be receiving it soon.
Okay, next question for Dr. Roussin. Doctor, can you confirm that the fourth person who died in Manitoba, you previously said that man had been in the personal care home. But can you confirm that was a Poseidon case that we and others reported on yesterday after Poseidon went public?
Well, I can. We've had that one death from a personal care home. The client was at one time in the personal care home, died in hospital, and investigations revealed that it likely wasn't in the infectious period while at the personal care home. So that's what I can confirm.
Thank you. We have a few moments left, so if our reporters have any other questions, please feel free to ask them now.
Dr. Roussin's partly here still. Has public health completed its investigation into death number 5 in the Westman region one?
Westman. So
Sorry, now.
yeah, well, certainly the investigation for contacts and contact tracing has been completed. With that, I think that there's always been a question to me on where it was acquired, and I don't think we can confirm that. There's a 14-day, up to a 14-day incubation period for the virus, so it's often difficult to know for sure where somebody acquired it.
Dr. Roussin, Steve Lambert from the Canadian Press. I'm wondering if you can tell me what percentage of cases and what percentage of deaths have been linked to personal care homes?
Well, there's been, I believe, 2 cases and 1 death.
That are residents of personal care home?
Well, 2 that were once a resident, and no deaths that were, present residents when they died.
Dr. Roussin, it's Brittany from Global. We've been led to go to the government site for all updates when it comes to events or places where there have been confirmed cases, but there seems to be quite a lag in actually getting any of that information onto the website. The latest one up here from when there was somebody from the Selkirk Regional Health Center emergency department that tested positive. Are you guys going to be updating that on a more timely basis so people can try to do their own contact tracing?
Well, I think we've always been saying, we will announce, as quick as we can if there is a case that we feel the public needs to be aware of. Most times, and including that one, the contact investigation was quite thorough and quite timely. And so we did announce it because we wanted everyone to be aware, because there's a possibility we couldn't get to everyone with the contact tracing. So I don't know offhand on the process of getting it posted on there. We can certainly look into it, but we would announce quite quickly at a event just like this if we felt that there was a high risk exposure that the public needed to be aware of.
I also know that you're going to be releasing your reopening plan later this week, but we said it's going to possibly quite similarly follow Saskatchewan. Are we anticipating that we could see some non-essential businesses start to open here at the same time frame there around May 4th?
Yeah, I want to save the details for when we have our completed final plan, and so that's going to be this this week sometime. So I want to just be able to comment when we have the final plan ready for discussion.
Hi, Dr. Roussin.
Dr. Roussin, partly Keith is here.
I just have a question about following the numbers very closely. You said as we open, we'll be following our numbers very closely. Can you talk a little bit about how you'll be following very closely? I'm just wondering about testing and contact tracing, if businesses will be required to check people's temperatures before they enter. Just what would that look like?
Well, for following the numbers closely, certainly the total cases and the makeup of those cases. Are they community-based transmission? Are they based on known contacts or travel? We'll look at hospital admissions and ICU admissions, and probably most importantly, our positive test proportion of tests we'll be following over time, which gives us a good indication of some of the community-based transmission and increase over time. So those are the type of numbers we look at. As far as the screening goes and these non-essential businesses that we're opening up, that's all going to be part of the plan. So again, once we have the final plan, I think we're going to articulate all the details at that time, and so we'll wait for that completed plan to be issued.
Dr. Roussin, it's partly Keith is here from CBC. I've been told that hair salons have received notifications from the province that they'll be reopening on May 19th. You don't want to talk about your plan just yet, but can you confirm those notices have gone out?
I can't confirm that.
Why?
I'm not aware of any notice going out to anyone. We're finalizing our plans as we speak, and so I'm not aware of any communications of that nature going out.
So what would you say to her?
Can you tell us when you anticipate to finalize those plans and when you'll be able to share them?
This week?
Any date?
No. This week we'll have those finalized.
What would you say to a hair salon that's been telling people they're reopening on May 19th?
I would say to probably check our website and we'll make sure we communicate broadly once we have our plan in place.
Dr. Roussin, it's Michelle from CTV. I have a question about campgrounds. We know that some of the reservation dates were pushed back and others reservations have been held. Have there been any changes with that, or is that still the same?
This is going to be part of our reopening strategy, so we'll be able to comment more detailed on that later this week.
Dr. Roussin, it's
Hello, Dr. Roussin,
again.
it's Mohammed
I know
from
that you can't tell us anything until later this week when those plans have been finalized, but maybe you can give people a sense of what takes so long to finalize those plans, because I know we've been looking at Ontario, we've been looking at Saskatchewan and other provinces. Why does it take so long to come up with such a comprehensive plan to make sure when we're ready to release it and ready to go out with it that we're very sure with what we've put out there?
Yeah, so I mean, our plan is Manitoba focused. So we spent our time looking at what's going to work for Manitobans, and so we're going to announce that this week, and it's going to have some similarities to other plans. It's going to be unique in other ways, and so we'll be able to provide those details later this week.
Hello, Dr. Roussin. It's Mohammed from Radio Canada. I have a question about First Nations community. How are you monitoring the situation in the First Nation communities here in Manitoba?
So the First Nation communities are right from the beginning have been linked into our incident management structure, and they're following a number of our guidelines. We've testing's been available and for quite some time in those areas. So we're daily meet through our IMS with representatives from First Nations and Health Branch. We have other committees that are ongoing. I don't know, Lanette, if you wanted to comment on some of your work you're doing.
Yeah, so we continue to have those conversations. They're an important part of our planning, and we are working with First Nation Inuit Health Branch to really focus on whose role is what and where are those accountabilities. So really with COVID-19, the big strategy is public health and primary care, and making sure that what they need in the community is available. And if they need to come out of the community, whether it's for isolation or if it's for admission to a hospital, how do we make that happen, working with emergency response services as well as our acute facilities, our hospitals. So those conversations happen every week, multiple times a week, and we're committed to making sure that that is a solid plan.
Diana from 680 CJOB. Dr. Roussin, are manufacturing plants being patrolled at all to see if they're meeting requirements for social distancing and safety measures? Obviously, as an essential service, work is still going on there, but just wondering if those are being checked out or if it's kind of an honor system as far as physical distancing measures goes.
Well, I mean, a lot of it is just what Manitobans have been doing. Manitobans have stepped up, followed public health advice, and our numbers are showing that. So there are mechanisms for looking into things. Workplace safety and health could be involved. That there was issues that were brought forward, but for the most part, it's showing that Manitobans have been following public health advice.
Thank you. And this concludes today's media briefing.
Thank you.
Thanks.